Hi, thank you so much for listening to Joyscape Therapy Podcast. In order to earn a CE, listen here for the code words, then visit our website at www.joyscapetherapy.com/CEUS. You will enter the code words and your BACB info at checkout, then receive your certificate in 5 to 7 business days.
Hello and welcome to the Joyscape Therapy Podcast. I'm your host, Maryssa McKenzie. We're happy to have you here today. We're going to be discussing interprofessional collaboration. And today we have our guest, Jennifer Rillamas. And we'll give her an intro in a minute, but I wanted to just remind you, thank you for coming here. Today's episode will be 1 CE credit, and in order to get that credit, please listen in for the code words that we'll provide throughout this episode, and email podcast@joyscapetherapy.com. So without any further ado, I want to introduce Jennifer Rillamas. Go ahead and tell us a little bit about yourself, Jen.
Yes, thank you so much for having me. I'm really excited to be on the podcast today. So, my name is Jennifer. I am a program director here at Joyscape. I'm also one of the family engagement specialists. It's a really cool role that we have where we get to really collaborate with clinicians and their families and really give our families opportunities to connect with one another, to kind of build some community, and also provide them a lot of resources as well. So professionally, I have all these fun letters after my name. I have AMFT, BCBA. So I'm a board certified behavior analyst. I got my BCBA just January of this year. And then I will be sitting for my licensed marriage and family therapy license exam in May. So I got my master's in counseling psychology. I originally wanted to go into the realm of marriage and family therapy. I actually didn't know what ABA was at all. And it's kind of a funny story. I had a friend who I worked at a summer camp with, and she knew that I was starting my MFT program for my master's, and she said, hey, you want to be a therapist and you want to work with kids, right? So, I have this awesome job for you. And I was like, okay, cool, sounds amazing. Literally, just threw me right in. I'm sure a lot of us potentially, we interviewed and we probably heard back shortly, yeah, we want you. And so I really didn't know anything about autism and didn't know anything about ABA, so I kind of just got thrown into this field, and I ended up loving it. I was like, man, this is my jam. Even as a marriage and family therapist, I won't bore everyone with the details, but essentially there's 4 houses of psychotherapy, one of them being the behaviorism. So that's going to cover behavioral therapy, cognitive behavioral therapy, dialectical behavior therapy. And so I already knew that I wanted to go in that direction as a marriage and family therapist. And so it was very natural for me to also consider becoming a BCBA as well. I can remember, I think 2 months into working as a BT, the CEO of the company pulled me inside and she's like, you're natural at this. You should consider,
nice.
Becoming a BCBA.
When we spot them, we want to keep them.
I know. Yeah. And what's funny is, that was 6 years ago. And so it's so funny that now I'm here. I've, been still pursuing both routes, MFT and BCBA, which I think will kind of blend really nicely into what we're going to talk about today. Yes. I'm really passionate about families, multicultural awareness, psychopharmacology, so also the role that medications play in our treatment of different disorders, and also really passionate about trauma-informed care.
Awesome. So quick question, just because you have pursued both, right? How have you found the time?
Oh, that is such a good question.
We always ask, anytime we have a guest speaker, is who are you outside of your role? But also, so first and foremost, how are you managing both? And then also, who are you outside of, both of those hats,
Yeah, absolutely. So I am very lucky that I was able to kind of pursue the programs not at the same time. So I did my master's first from 2017 to 2020. And then, pandemic happened, and I was really looking at what I wanted to do with my life. And I really did decide at that time I wanted to become a BCBA. And so I had already finished my master's program when I decided to enroll for my graduate certificate in ABA at Florida Tech. But even doing that, it's a fully online program that I was able to do, which is great, but I was working full-time here at Joyscape, and I was taking classes, and so I definitely wasn't the best, I will be completely honest, at like managing having a life like outside of work. And so, you know, I was really lucky to have awesome supervisors and mentors really push me to make sure that I'm taking care of myself while I'm pursuing all of these things at the same time. And so I did get a lot better about, you know, my weekends. That's me time. I was doing a lot of studying, but I was still trying to push my studying more towards the week. You know, where can I utilize gaps in my daily schedule efficiently? And so really just maximizing my time. I already thought I was good at organization and time management, but this process really took it to a whole other level. And so I think I've gotten a lot better at it now. And so I'm just really grateful for the support that I had from like my coworkers here at Joyscape, because people were really understanding, like they know what you're going through, and they're like, how can we help you? How can we support you with all the time management?
Awesome. Yeah. Great. And who are you outside?
Yeah, outside. Oh my gosh. So I love spending time outdoors. You know, you usually ask somebody, well, are you like a beach, ocean person or a mountain person? I'm a mountain person. I love going camping, hiking, backpacking. It's been a little damper because this weather has been insane. But I'm hoping once these storms pass, I'll be able to get back out there. I also love to travel. I have a trip planned to Ireland later this year, which I'm really excited about. I know you love to travel as well. And then kind of some nerdy random things about me. I'm a huge Survivor fan, the TV show. Like, I will be on that show one day, like, just you watch. So, you know, Jeff Probst, if you're listening, keep an ear out for my audition tape. And I also love Ted Lasso. Those are two of my favorite TV shows. I watch them religiously every week, so...
Great. Yeah. I know sometimes it's such an easy, and even with the question, I feel like we always like kind of graze the top of that, but like it's such a core to like what we do on a day-to-day, right? Because we bring our own lens to everything we do. So, you know, it is essential to kind of remember that. So I always try and make it a point to like ask and get to know, like, what do you enjoy outside? So that's cool.
Yeah, and I
outdoors.
think it's important for me to mention also, one reason I think that the outdoors is really great for me as like a hobby thing that I do on the side is that a lot of times I go places where it causes me to disconnect. Like literally, like, you know, go off the grid. Like, I'm not going to have service. I can't check my email. I can't get phone calls because I feel like, you know, this day and age we're so connected. And so for me, I think it's helped so much to have to be removed and put in a situation where I literally can't access those things, and I get to really be present, because with what I do right now, I try to be really present in my sessions and everything I do, but it can be it's so easy to just think about, well, what report do I have to do next? Or like, you know, oh, that indirect time, I got to get to that indirect time, or I have this project that I have to do. But when you're out in nature, hiking, camping, and you're literally off the grid, it's just like, no, all you can do is be, and just be in the moment. And that has been so beneficial to my self-care, and how I've been able to manage everything is just really give myself those times to pause.
That's wonderful. I know. I feel like I need a vacation now. Okay, great. So let's dive into the article. So this week's article is by Bowman, Suarez, Weiss, and it's titled Standards for Interprofessional Collaboration in Treatment of Individuals with Autism. So the purpose of this article was to describe the current need for effective interprofessional collaboration and provide clear criteria that promotes transdisciplinary care in the service provision for individuals with ASD. So it's a really big kind of purpose, but I think they do an awesome job. Like, even we'll kind of go into this really cool visual they have, and they kind of break down like multidisciplinary, interdisciplinary, and transdisciplinary collaboration, and they sum it up very nicely by using like food, and we all love food.
I love food.
I mean, so how could you not relate to something like that? So I really was just super attracted to this because of that visual, and then later kind of reading further into it, I just love kind of that comparison that they make and relate it to those things, and then bring it back to how do we create a standard to continue to have good collaboration, effective collaboration. So let's dive into it and kind of discuss just a few, like, brief, right? Like, why is collaboration necessary? I think is a really good kind of first thing to like start off for us. You know, I think when we talk about autism, a lot of the time that comes with comorbidities. So with that meaning, that the client might be diagnosed with ADHD. They might have seizures. That's another common one that I see. I don't know if there are any others that you see as well. But with that, it kind of goes out of our scope. It does go out of our scope. That's a pretty clear thing to say. So when that happens, we are required to address, if we're looking at client-centered, right, we have to think about that client isn't just an individual with autism, right? He or she might have other things that they're dealing with. And because it's out of our scope, it's super essential that we are collaborating. So yeah, just kind of diving into what does collaboration mean when we're talking about our services? And I would love to hear from, your lens too, of how to work with that and how to work with other individuals, how to relay that and be a bridge for parents. I think is a challenge that I also find, it's okay, scheduling, you have all these challenges to collaboration. And in the article they mentioned, this was one line, it's just because you're scheduling meetings does not mean you're collaborating.
Right.
It was just yes, that is so true. They really do a good job, I think, touching on what types of intangible qualities, respect, trust, understanding, that I think that we know, but to actually do it in practice and keep it consistent is really hard. So yeah, for you, what does collaboration mean to you? Even just coming from as a BCBA.
Yeah, absolutely. So I work a lot specifically in early intervention as well. And so, I've got kiddos typically under 3 years old. And a lot of times when they're first diagnosed, doctors come to them and they say, okay, so you're going to need ABA, you're going to need occupational therapy, you're going to need speech and language, and so it's all these things. And so a lot of times, if families don't have a history with a child with autism, it can be a lot for them to understand, well, how do all these pieces fit together and how can I, which one is quote unquote more important or which one do I prioritize or which one, just how can I fit this into my life? And so I think in the scenarios I've encountered thus far, I really like to, the article talks about this idea of a need for a case manager, almost to kind of help organize and how to help really facilitate everything. And I realized in reading the article, that's kind of what I try to do for my families is I try to help them make sense because oftentimes the BCBA, ABA therapy is the one that they're going to have the most hours for weekly. And so how can I model for them? How can I reduce their stress to help them understand the role that all of these people are going to provide? And then also model for them, how open I am to collaboration. And so really meaning, sitting down with these professionals, tapping into their expertise, trying to see from their lens, how do you see what's going on right now? What tools do you think will be effective? And how does that align with what I'm also trying to do? Or how can we, even if we have maybe disagreeing perspectives, which I know we'll touch on a little bit later, it's how can we, instead of just being, well, I don't want to do that. Well, I don't want to do that either. I can't do this and I can't do that. It's and how can we say yes to one another? How can we go, okay, yes, and this is how I might do it? Really, really seeing, that's what I see good collaboration. Like you said, collaboration, it just isn't just showing up to a meeting being these are my goals, these are my goals. Okay, great, now we know each other's goals. It's so much more than that. It's how can we interweave what we're doing to really just exponentially see the results of our clients.
Yeah, and they touch on that too of each person brings their own perspective, but if we're all working on it in a parallel direction, then it's actually probably doing more harm and causing more confusion for the family.
Right.
So I love that. I love that you pointed that out. So yeah, let's kind of go into this visual and kind of explain it as best we can. But yeah, so multidisciplinary, they kind of have different, they compare it to a salad. And so just in short, professionals are working in parallel. Their communication is minimal and they're focusing on discipline-specific tasks. So you kind of just have your ingredients, you put them in there, and it's just kind of a tossed salad. Anything to add to, feel free to chime in as I go through the visual. But so the interdisciplinary is another. And they talk about tasks are coordinated, frequent communication, shared goals and responsibilities, and disciplined roles are maintained. So you start to see a different level of just kind of that integration right? And I think you had mentioned too, like, this is kind of the realm I feel like also too I sit in. I'm like, okay, yeah, interdisciplinary. You also hear that a lot. But you know, it's important too, I think, is to really understand these terms. That's one thing I've been working on, even with having the podcast. It's always a little bit nerve-wracking. You know, I'm just another BCBA out here disseminating research, but also learning with the audience, with my guest speakers, because I don't know everything. Yeah. So it's really super helpful to have these open conversations and have the research to be like, oh, I learned this. Like, I didn't know. If you would have asked me a couple of days ago, you know, what kind of collab? Oh, interdisciplinary. Like, yeah, I do that. But then to hear that there's this thing, so they compare interdisciplinary as like soup. And then they go into transdisciplinary as a role release, role expansion, integrated expertise, shared problem solving, and unified treatment plans. And they compare that as a cake, like a piece of cake. It's like a whole, and it looks so great, and it's awesome. And
yeah, and you can't tell the ingredients from one another because they all come together to make the one item.
Yes. So yeah, I just really loved this visual to kind of understand, and that's really what they mention as like the goal, right? Is the transdisciplinary collaboration and being able to really hone in on what you guys are doing and sharing and learning from one another, right? And building trust throughout. So they talked about having just different degrees of collaboration. Those were referred to as models of collaboration, I should specify. And that the term interprofessional is kind of more of the umbrella that all of these models lie in.
Yeah, I really loved being equipped with these terms because like you two, I would have just said interdisciplinary. But then looking at these, it's like, wow, I can see where the direction I may want to go, or like really be able to talk about what I'm doing in that moment. And so I just loved getting equipped with more vocabulary to use.
Yes. And also even looking at the comparison, right? Because interdisciplinary into transdisciplinary is understanding like, oh, on that team, I could see that's where it is. And I love how they gave like actually like a standard, right? Of kind of, and in the conclusion, they sum up like, it's a lot. It's complex. It's so much more complex than just bullet pointing these really essential pieces to collaboration, but being able to continue to expand on what these look like as a profession. And that's really like what I love about the podcast as well, is opening these things up to discussion, right? And really understanding like how to get those wheels turning and make it applicable, right? So I kind of had a point on mine. It's like working with professionals that do this well has made me a better clinician. So I've particularly done a lot of co-treatment. And for some of our audience that might not know, so sometimes we will so I'll bill my ABA code, and then if the kiddo has, say during my 3-hour session, the kiddo has OT or speech scheduled for 1 hour, sometimes 45 minutes, 1 hour. And I basically continue treatment and assist in that. So it's kind of like the learner is receiving 2 different providers at the same time. And of course, there's some times when maybe this is not appropriate. But personally, I have been able to not just meet over a Zoom and learn about what the OT or the SLP or whomever is working on, but to see it in practice, to hear the thought process that the OT or the SLP break down how they're doing what they're doing, why they're doing what they're doing, right? In the moment. And also having the parent in, sometimes it's also, there's pros and cons to this, but for me personally, this co-treatment has really, and I've done it before in others here and there, but I've done it a few cases recently that I've just felt like I'm a better clinician because I'm implementing things that have been taught to me, modeled, and also validated of like, hey, let's try this out, and this is where it helps. Like, so I think that piece of collaboration has truly made me a better clinician because I'm doing things of like, oh, look, like I'm seeing their body activate in a different way, and I'm keeping their energy up because I'm using this little strategy, and this little strategy is like evidence-based and OT supported, or that's just my example, but it's really awesome to see like, wow. And I think that's where a lot of like the respect the trust also has come in, right? I see it with my own eyes and I hear it, and it's just another level for me. So I really think that I've had a couple of OTs and SLPs here recently within the last year and a half that have changed my lens of like, that is how you collaborate. And they model for me how to stay on top of like, oh, hey, I have this recommendation. They sent a journal article to the entire team email. One parent has, I think they mentioned in here, creating a group email for the entire team. And that seems so like, of course. Yeah, why not? But the parent did that. The parent initiated that because sometimes it is overwhelming. So just coming onto a team that was already kind of established, I know like, oh, we can do this with this other kiddo because he has, a couple different providers that make it a little bit challenging sometimes to send separate emails, right? When we talk about time efficiency, that's a big piece too, right? So yeah, anything to kind of add to that before I move forward?
Yeah, no, this past year, I too have had so much success in co-treats as well. And right now I'm working with an awesome SLP where, we've scheduled monthly co-treats that we've been doing, and parents are present as well. And we're really able, I feel like me and this SLP, we're very on the same page with goals. We're checking in with each other. It's like, hey, I'm seeing this is an area of need. Are you seeing this as well? And it's like, yes. And so we're making sure that our goals are very aligned. And, there are some times where parents have been a little like, oh, well, what's different? Like, it's good that you're both doing it, but then why would I necessarily need both of you if you're working on the same thing? And so also being able to explain the need for, the SLP may work a little bit more on articulation versus I'm working on the functional aspect of it. So I'm so awesome to see how he is being able to, the SLP is able to work with the client on saying something a bit more clear. I just care that they're using it functionally, So for me, maybe I'm accepting them, giving their best approximation, but the speech therapist is like, no, we can push it. We can get that articulation. And it's like, great, teach me, tell me. And so we're really able to handle this goal and I don't want to say attack it, but we're able to really target it from all these angles, and the data is showing that it's working. The data is showing that it's working. And so this is just such a necessary thing we need to be doing.
Good point. So yeah, just kind of notes of seeing this in action, being transparent about having different views of what they see, and it feels right because I've also grown to understand that my perspective is not the only perspective, and I say that not in a overly selfish way. It's more of I know what I know, but where I felt like I started to grow as a clinician is to also say, oh, I don't know that, but I can learn it. Right? And then I can learn it from this really awesome SLP or OT and I think the audience might hear us keep saying those, but those are probably the most frequent that we're alongside, right? A lot of, like you mentioned, when our kiddos first come out of being diagnosed, oftentimes it's a whole laundry list of OT, SLP, really get that early intervention in. So oftentimes we are working pretty closely with the SLP or the OT. So Jen, what has your experience been like working with other professionals on a team, and maybe also sharing times when we are not co-treating, or when it's a little bit harder, right? Because that is pretty common. So we have these teams where oh great, that's a model team, and I want to try and generalize that with my other team too, but kind of how to get that started, and what have some challenges been like, or what does it look like when it's not as cohesive? Sure.
So one of the first cases I had when I came to Joyscape, it was definitely more this multidisciplinary. It was really, I was doing 30-minute check-ins maybe every month with the SLP and OT, and it was really more me just hearing about what their goals were, and I wanted to get some recommendations from them. I had a high need client, and so I just wanted to know, how can I best be supporting this client? How can I be sensitive to their fine motor, their gross motor needs, for example, or especially with the speech, working with a nonverbal kiddo, how can we, just making sure we're all aligned. And so, but it felt very much so like a salad. It didn't really feel like we were doing things together, or really, we really weren't working in the same direction or anything like that. I will say I've definitely moved in the direction of that more interdisciplinary, and I think moving even a little bit more to that transdisciplinary. So, I have different experiences, both as a BCBA, so Board Certified Behavior Analyst, and then AMFT, so Associate Marriage and Family Therapist, meaning I've done the criteria to sit for my licensing exam. I just haven't sat for the exam yet. That's what that associate means. But in my work as an MFT, AMFT, which I've done outside of Joyscape, you know, I've collaborated with psychiatrists. I've collaborated with doctors. I've collaborated even with teachers as well. I mean, I would say that I collaborate with teachers at Joyscape as well. And so, you know, when it's more, I think, the medical side of things, when it comes to like psychiatry or working with a medical doctor, that for me has felt a lot more transdisciplinary in the sense that I may not be able to prescribe a medication to somebody, but it is my duty to know about that medication. It's my duty to know as an MFT, you know, why is this prescribed? What does it do? Even understanding a little bit more about the biomechanics behind the drug, like what does it actually do to your body and why does it work? And so, you know, being able to provide what I call like psychoeducation, being able to, because as a therapist, my clients are going to see me probably a lot more than they're going to see their psychiatrist. My clients are going to see me every week versus their psychiatrist, they probably see once every 6 weeks. And so really, who's the person helping them manage the side effects? It's me. And so I'm actually very grateful that as a marriage and family therapist trainee, I've had that experience because I see that now in my work as a BCBA also. You know, where kids are on medications, you know, and, you know, we do what we can to understand, but really I think as a BCBA, we're not pushed as much, or we're not provided that education on drugs, and we're not expected to know necessarily, but even just being informed in that way, I'm not expected, again, to be able to prescribe a drug or even give recommendations about, oh, maybe you should go to a higher, lower dose. That is not my role, but my role is to recognize side effects. My role is like, is this, you know, something from the environment that's happening, or is this an internal thing that's going on? Like being able to have more of a trained eye and trained lens to be like, hey, maybe you need to go back to your doctor, or like maybe we need to consult on this with somebody else. So, you know, I think that is where I've seen the most work move more towards that transdisciplinary angle. And so that's really what my experience has been up until this point.
Yeah. No, that's really awesome that you talk about that, like, because we deal too, like you mentioned, we see them more frequently, right? And also understanding like the limitations, you know, when things are not working and we're trying and, you know, we're working with the family to like modify things, but there's just something else that, you know, that maybe is out of our control and maybe out of the kiddo's control, right? Like that is a huge deal to understand. So, you know, really, even again, these are things that I feel like I've just developed, and you're in your first year, so I would love for you to come back on after your first year, because you really do learn so much. And I don't feel like I got this skill to be like, to know, hey, I need to know the side effects of what is it for, like you mentioned, right, of the medications, because I may look at it from one way, but I have to understand the child as a whole, the child, the learner, you know, and then know, okay, hey, I have to consult somebody else. I need to, you know, and encourage the parents to do that, right? And it's so easy to get caught up in our day-to-day that scheduling can often be like a barrier. It's a very real barrier. You might hear me mention it again, but because it is, right? And when we kind of go from one thing to the next, it could very much slide through, but it's so essential. And we'll get into too some of the standards that they mention of like how to remedy these things. And again, continuing to refine as a whole. This is another question I had. So as a new BCBA, do you find it intimidating to initiate contact, whether it's a new case or sometimes a case that you kind of inherit? It's also hard to like get the wheels going. You know, it's like, especially if that wasn't maybe, if it wasn't like an interdisciplinary or transdisciplinary approach at that time. So yeah, have you found any challenges there, or, you know, do you kind of, in previous episodes, we've talked about like imposter syndrome. Because even for me, a couple years in, it is uncomfortable sometimes. I'm like, okay, let me make sure I know, you know, my stuff and I know the questions I'm going to ask, you know, when you, especially psychologists, or that's when that'll reach out doctors, you know, of just like, okay, what are my questions, and, what are we dealing with here? So yeah.
So yes and no. I've found it intimidating. There's been cases where they're fresh, they're brand new, no one has ever made contact yet. And so that in those scenarios, it's really easy for me to just be like, introduce myself. Hi, this is who I am. This is what I would like for us to do. I like the opportunity to kind of be the model for that and like let these providers know, these other providers, hey, I'm so open to collaborating with you. I want to, hear from you. I want to work with you, those kinds of things. I will say the most intimidating scenarios, similar to you, psychiatrists and doctors tend to be a little bit more intimidating for me. And to get a little vulnerable, I think for a while it's because I wasn't a BCBA until January, right? And so all of the consulting I was doing before, it's like, well, like, who am I? Like, I'm not a BCBA. Yeah, I don't have this. But, 4 letters doesn't really change who I am as a clinician, right? They just give me that, the credential, essentially. And so I had to do a lot of, like, personal internal work to be like, just because I'm not a BCBA, it does not make me less than. I am this person who genuinely cares about my client. I want to put my best foot forward. I want to serve them and serve their family. And so really reorienting myself to be like, this is why I'm doing it. I need to put my ego or therefore lack of ego aside to just, be like, I'm doing this for the right reason. Yeah. And so I'm definitely more comfortable with it now. I will say it was hard. There have been a couple cases that I've inherited where this child has been getting speech and occupational therapy, as well as ABA that I inherited, but no prior contact had been made to them. And so for them, it was a little like, well, why are you doing it now? And so, I think it's easy to approach it just, well, I'm the new clinician on the case, I just wanted to make contact. And, if they're open to it, great. If they're not, that's fine too. Luckily, in those scenarios, I've been able to work with the parents who are able to kind of, relay information to me from the speech and OT sessions if I'm not able to make regular contact with the speech language pathologists or OTs. But
yeah. And they mentioned that too, when even clinical recommendations conflict or they don't align, that then also causes, mistrust of maybe, like you mentioned before, parents having to choose, right? You only have so many hours in the day. Right. And same for the client, right? Like, especially if they're going to school. So even with that being said, of making sure that our recommendations align, but all we can do is put the effort out, right? And it's unfortunate sometimes when that is, so they address later, we'll talk more about the conflict resolution and how to go about that. And, sometimes I think if we do a good job with this, the parents will initiate this as well, right? Like, hey, I know that speech is, essential. And unfortunately, for some reason, maybe we're not getting much traction, whether it be any other provider, right? But we're attempting to collaborate and to, get this underway. And it's just not happening. And sometimes when you hit a wall, you have to reassess. So that's also part of the team, because sometimes we're not getting that reinforcement, right? It's like, oh, why, no, we're not able to collab. Why? So then it might be then the rest, the team that remains making a decision like, hey, do we need to go to another provider? Would that cause any delay in continued care, right? Would it do more harm than good? Right. But sometimes those decisions are necessary, and being able to communicate as a team is a really good example. And so sometimes when we hit that bump, like, what do? We have to check in. And you mentioned before, even just talking about like talking to doctors or psychiatrists or psychologists. Have you ever had a peer-to-peer review call? I
haven't yet. Please tell me about your experience with it. I have not yet.
It was just kind of, because I get it with funders. And when we're talking about funders, it could be your insurance. And some may look at the report depending on age and, history of services. Sometimes the funder will ask for consults, basically, and a peer-to-peer call where you kind of break down your report. And so this I brought up because it is a form of collaboration. And I say that with a question mark because ultimately they're the deciding factor. So sometimes you might be talking to another BCBA. So I've also spoke to an LMFT over the phone and or a psychologist. And recently I had a really hard call. And there was a lot of rationale to continue services, and particularly our services. But I find that sometimes peer-to-peer review calls can be intimidating. And I think I hope that they're not. And the more we talk about that and really encourage the clinician to be confident in their recommendation, confident in knowing their report and their rationale, because it does feel almost like you have to give reasoning for everything. You're being questioned.
Yeah, you're kind of put under the microscope.
You're put under the microscope.
Yeah.
Yes. So preparation is key in those peer-to-peer calls. But I just kind of threw that out because, it's a different type of collaboration because it's a necessity. You have to, in order to get the authorization to continue services, you're going to have to speak and go through the peer-to-peer call. But sometimes I don't always feel like, and that could be a whole another episode, but sometimes I don't feel like, we're on the same page. Mm-hmm. And, that's the conflict part too. They're seeing it from one end of their lens, and we're seeing it from ours. But it's like, how do we make sure that we're conveying in a short amount of time? Sometimes it's a 30-minute call. Sometimes it could be a longer call where they're piecing things apart. But yeah, I mean, anybody who maybe hasn't had a peer-to-peer but has heard about it, we could always do like supports. Those are good to just have someone present. I've literally had like my report laid out and, just little notes in case I'm asked about this or that. But it does, doing a few of those, your confidence will go shoot all the way up, whether you get quote unquote denied, because the authorization requests can get denied or accepted. And so that's a little bit, like, oh, did I not explain? Did I not advocate? That's what I felt when I first got denied. Did I not do a good job advocating for this family? Did I miss some essential pieces? Did I not validate? So just kind of, when we're collaborating, really understanding, okay, and they talk about jargon as well, right? So how to communicate my scope of competence to another individual. Right. So another big piece, but not to scare anybody, but just kind of a really good offering validation for goal selection, progress, or lack thereof, and just really being able to give reasoning to some of those. And confidence is key. Mm-hmm. So kind of transitioning here, my favorite quote in the article, I'll read it here. So the level of harmony purported by transdisciplinary collaboration demands mutual trust, respect, and confidence among team members. And so I just loved this quote because these are objective. You know what I mean? Like, they're objective, but they're so essential to what we're doing on a day-to-day, right? And this goes not just to other professionals, but the families, and even our so at Joyscape, we have co-BCBAs, we have program managers. So really approaching this on just a wider scope I just love that, because without that, I don't think you can fully receive information, education, training without opening these things and having the trust, respect, and confidence in each other. And that takes time, of course. It's not just going to be like, oh, you did this, so I'm going to receive everything. But it's the teamwork piece. And they also mentioned, like, they're pushed outside of their zone, outside of their comfort zones, away from their autonomous, monodisciplinary views and into a perspective that transcends conventional boundaries. So I just kind of wrote a blurb of, like, this is what creates better clinicians and in turns lead to better outcomes. It's when you see it done beautifully, and that, to me, I do have a team that I wouldn't, again, have labeled it on my own. That's this transdisciplinary model of collaboration. Mm-hmm. So when you see it and you have it, it feels different. Yeah, it really does. And then also you see progress, and you're just kind of blown away of, like, that's what it means to have an efficient team for this client and this family. Mm-hmm. So yeah, just kind of going into, like, what the article mentioned as benefits. So collaboration may be more preferred by clients, and they increase treatment integrity. They result in better maintenance and acquired skills. And I really like the emphasizing of this is that disseminating the science of each discipline, partnerships, networking, enhancing overall quality of treatment. A caution that ineffective collaboration can lead to an incompatible mix of disciplines that could cause more harm than good. And the code word for today, we'll do cake.
Love it. Love me some cake.
That's the first code word. So yeah, Jen, I don't know if you have anything to add before I kind of go into like talking about some of the basics of collaboration.
Yeah, I think I would just love to add that quote that you pointed out. I love that quote as well. And I'm going to be cheesy and like quote one thing from my favorite TV show, Ted Lasso. There's this episode where he talks just about being curious, like holding this level of curiosity. And so it can be so natural when somebody, you know, someone you're collaborating with may say that they wouldn't recommend what you're doing, or, you know, you may interpret it as them trying to tell you how to do your job. And you may have this like gut reaction, like just to, again, defend what you're doing because you believe so confidently in it. And I would say us as BCBAs, we almost have a little bit more confidence because we know that what we're doing is based in evidence. And so we're like, well, how could we just not do this? You know, we're just like, how could you not? And so I think it's just so important though to maintain that level of curiosity and say, I hear you. Can you tell me a little bit more about that?
Yes.
You know, not immediately saying no, just being like, okay, I hear you. Tell me a little bit more about that. I am open to hearing more about it. And so I've loved doing that with some of the, you know, speech language pathologists and occupational therapists I've worked with. It's just, I get to learn so much. I just get to learn. And I would hope in turn that they would be open to learning from me as well.
Yes. Wonderfully said. I kind of had a question, but more of like a topic conversation of, is ineffective collaboration like having too many cooks in the kitchen?
That is such a good question. So it's funny because some of the best restaurants in the world have so many cooks in the kitchen, right? But they're working as this like beautifully orchestrated team. They know how to move around one another. Everybody knows what part they're supposed to be working on, and how it all comes together to make one meal, right? And so it's funny when you say too many cooks in the kitchen because maybe sometimes you need that. Sometimes you need that. However, if the recommendations are conflicting, you know, if someone's saying, oh, we need more pepper, it's like, no, well, we need more garlic salt. Like, what are you thinking? And so it's like, okay, if these recommendations are conflicting, then yeah, you're going to come out with a cake. I'm totally just using like things from the article, food from the article. It's like, yeah, if someone says, no, it's not sugar in the recipe, it's salt. Clearly, if you put too much salt in that cake, it's going to taste horrible. And so it is really about making sure that things are more aligned. And so I think it's, if those recommendations are conflicting, like you said, it really can do more harm. It really can do more harm. And, you know, I will say, I have actually run into a case where previously, before Joyscape, a client was receiving ABA services from my agency and actually another ABA agency. And so at that point, that was a really hard case for me to navigate because not that we were necessarily conflicting, but we just had different priorities of which goals we thought were more important than the others. And so, you know, that was hard for parents because like, well, one person's saying this and another's saying that. And it's just like, that's a lot. That's a lot.
Yeah, and that's actually a really good point, too, because, you know, I think we have it kind of as a general, it does get very hard when you have two ABA providers. We're two tiers, so I feel like it's a little bit different for us. We carry a lower caseload, but oftentimes you see a 3-tier agency, and sometimes, a lot of the time, staffing is an issue.
Right.
So then we go into that realm of, okay, when there's some logistical things and we know we could provide the hours. So my question with that too is, when we're collaborating, there was a time that I had at a previous company where they were out of service, out of our service area. But they could come for like, I think the parent had commuted, or there was something that they could come to the center that we had. A limited amount of days, right? Not to fulfill the clinical recommendation, but just maybe social group opportunities. And the company I was with was it was a hard line. Because I said, okay, if he receives direct at home, working on parent training there, comes for social skills, maybe some one-on-one, you know, it could have been kind of molded. But there are some of those exceptions, right? Where I wonder, are we doing a good job collaborating, even when it is like another ABA provider, and working with some of the logistical, right? Particularly the out-of-service area. Those rural areas are not going to get as much service as you're going to see in these urban areas, especially our Silicon Valley, right? Like there's tons of opportunities. You have the issue of wait lists, which is, you know, another challenge. But yeah, that's a good point you bring up, because there are things to weigh out. When we're collaborating or making these clinical decisions, just kind of a side note and tangenting off. But yeah, it's interesting when we talk about even with co-BCBAs and with BCBAs from other providers, priority and focus. And again, approaching from curiosity and communication, not just meeting, but actually communicating.
Yeah. Like willing to listen and hoping to be listened to.
Great. So kind of transitioning into, I know we've mentioned a lot about like the conflict and how to kind of address that. So conflict isn't in collaborative services or practice is not uncommon, right? And I think one thing they mentioned was that we don't receive, in the university level, we don't receive a lot of education or training on collaboration in general, right? So then we're kind of thrown in, and I'm sure you're gonna, it doesn't matter until you actually do it and you're there and you're almost like on the island. You're not alone, but you're on the island after you pass your exam, and you're just like, oh, this is no longer like my supervisor's responsibility. This is my case. I'm setting the tone. So, sometimes navigating that piece, and when you have conflict, navigating that with ease and communicating can sometimes be hard. We have to put our emotions aside.
Absolutely.
Those are real.
Yeah.
That's going to happen. So understanding that we each have our own values, goals, approaches. So the remedy is to really understand, recognize, appreciate the contributions made by collaborating partners of the team. So they kind of touch on role boundary issues. Do we know what the other's contributing? I think we touched on a little bit of the conflict, but if you have any other examples for conflict that has arose, or even personal insights, on challenges you've seen either as a AMFT or as a BCBA that you feel like you learned from, and it maybe even could have been rocky to navigate, because that's very real.
Yeah, so I will say, when I first started doing my field work to be a BCBA, it wasn't at Joyscape, it was at a different agency. There were certain cases that I was given, that I was doing most of the direct work for, that I saw what was happening, and I couldn't necessarily turn my marriage and family therapy brain off. I just looked at what was happening, and I'm like, there's dysfunctional communication here. There are some issues in the family. They had also experienced a trauma together, and that hasn't really been processed, and people are getting really triggered. And the funny thing is that everything that I'm talking about can be translated into ABA terms, essentially, right? We talk about MOs, and we can talk about establishing operations and everything. So I have really had to learn how to sometimes walk or almost speak two different languages, and then also figure out how to translate them from one to another. Because I feel like, for me, I'm looking at this case, and I'm like, I see what this child is needing, but then asking myself, who is the client here? Is it really just the child, or is it really the family? Because the family might need support too, and we as BCBAs, obviously, we provide parent training and things like that, but realizing as I'm working as, a behavioral therapist, I see this need that maybe they may need more emotional support that I can't provide in my current role that I'm occupying, but it's something that I had to discuss with supervisors. It's how do we potentially offer that and suggest that to them, that maybe they need to go seek additional services with a psychologist, or maybe they need to get other referrals to other supports as well, because I think that is such a huge thing. It's kind of like a role boundary issue within myself, which is kind of funny to think about.
But very relatable. That is what we deal with. We bring our own lens to each.
Right. And I think as far as role boundary issues with collaborating with other professionals, I think that there's sometimes when I'm working in schools where the teachers will think oh, well, you're going to just teach them everything too. And I'm like, well, no, I'm not a teacher. I'm not here to necessarily work on academics. I'm here to help them, for the skills that they need to be successful, to learn and to be in this environment. You are still the teacher. You still get to do your job, and I still get to do my job. And so kind of setting the boundary there of like, I will help up until this point, I'm going to do everything I can to try and make your job easier, by helping them, helping the client feel as like calm and focused and engaged and excited about the work as possible. But you still get to do the direct instruction. And so I think like that has been a more recent boundary thing that I've been also working with.
Yeah. All right, so the article kind of proposes a solution with these standards to prioritize client care and value, and to value each discipline's education and unique contributions. They're intended to function as core standards for all treatment team members, promote unity, prevent conflict, and ultimately help practitioners achieve the most integrated collaborative practice among professionals of varying disciplines. So Jen and I will go into kind of ones that resonate with us the most, but just kind of as the standard that they proposed was kind of a list. So collaborative communication, distinguished roles, role organization, client care, conflict resolution, joint partnerships, evidence-based practice, and collaborative culture. So Jen, I'll let you go ahead and kind of start off. I know you had mentioned a few things out of the collaborative communication standard they proposed. So what resonated with you there?
Yeah, I think the ongoing communication piece was really important about having regularly scheduled meetings. But again, as we've noted, it's not just scheduling them, but attending them, and then also listening, using active listening, and then also making sure everybody's voices are heard in that. To go along with that, though, there's also a piece in there about mutually understood language. And I have to say that this is like a big pet peeve of mine, is that some people get really into the jargon of their discipline. And like, that's great. We all have to speak, in that profession, we all have to speak a certain language and use these common terms. But sometimes jargon can be really off-putting for people. And so again, it's like, how can we convey these principles to people, especially like across languages too. That's, again, I'm really passionate about multicultural work as well. And so, helping people understand across that as well. But really just making sure that we have language that is mutually understood by all members of the treatment team. Again, parents, teachers, everybody also, and trying to avoid the use of discipline-specific jargon where we can. And then if we absolutely have to use that jargon, it's like making sure that we are freely providing the supplementary explanations when language is not understood by other collaborating professionals. I know that I've had OTs before send me resources that I've been so grateful for, because it's like, I kind of know what you're talking about, but help me. And so they were able to send me resources, and I think that is just so amazing when we're able to do that. And again, not be judgmental about it, that you're not familiar with a term, and it's like, we're all in this together, and we want the same outcomes for our clients, so how can we get on the same page communication-wise?
There's a big piece in the article, too, that mentioned, when you mentioned jargon being off-putting, they talked about being too prideful. They mentioned it in a very, professional way, but I thought about that, and, that also causes the disconnect. Again, we're human, so we might have our feelings, too, of, maybe feeling incompetent or, intimidated is another good word too, but that pride can kind of step in when you start to use a lot of jargon and, really, again, like you mentioned, being on the same team, and having the same goal. Was there anything else from the collaborative communication that resonated with you?
I think those were the two main ones.
Okay. One thing to mention in that same standard, the first one, is that they mentioned research article sharing.
Yeah.
And I had it was an OT do that for our team. And I remember I've never thought of that. And it was very appropriate. We were talking about toileting. And she had shared an article and had a suggestion and put it out to the team. And I was like, wow, that is awesome. And so just to see it kind of written here, because I have never heard of that. I mean, especially to put it in something more formal like this, to here, this is a really sharing research with one another. Like you mentioned, I'm open, tell me more, right? So yeah, that kind of resonated with me, is just to see that. And, something I can incorporate too, when we talk about things like toilet trading, because that does also cross over into that realm with OT as well. And when we talk about AAC devices with speech, and really kind of getting on the same page to understand those things. And so the next you had mentioned client care as one of them as well. And for me, I wrote the emphasis of being client-centered and aligning with the team's mission and vision, like any recommendations or interventions, and being able to kind of unpack those together as a team and make sure that they align.
Definitely.
And one thing that I wanted to make sure to touch on was the collaborative culture piece. That's something that resonated because I went to Cal ABA this year, and it was just awesome. And there was an ethics training that mentioned exercising your ethics muscle frequently to make sure that we keep it strong, and because we face ethical dilemmas on, a very regular basis. So to be able to address these things and continue to get education and ongoing training that is surrounded around client-centered care and interprofessional collaboration is crucial. We have our ethics criteria, right, within our 2-year recertification. Is that enough? Mm-hmm. Probably not.
Yeah.
And so really it just does take just more active roles, because we didn't receive that in the university level, or maybe even the field practice level, which probably is a good transition. I know you mentioned you wanted to talk a little bit about the supervision, your supervision experience, mm-hmm. and, have we done a good job preparing new BCBAs or master's level students to transition into this role as a BCBA, but also to collaborate with other professions is another skill set in itself.
Totally. And just quickly going back to that ethics piece, I definitely highlighted that there's a piece in there that talks about each member should publicly share their codes of ethics, because all codes should be cross-referenced for commonalities and differences, because each profession is going to have their own code of ethics. And I think for me, as a aspiring, marriage and family therapist, we actually have to take a law and ethics exam separate to our clinical exam. And I hope future BCBAs don't come at me right now, but I actually think that should be a separate thing for BCBAs as well, mm-hmm. To really prioritize and show how important ethics are. And so it's important because ethics can also define our scope, right? So if we're working as part of this transdisciplinary team, we need to know, to what extent does our scope stop? Or where how far can we go, or where do we need to stop? Because I think that it is just so important to be able to respect each other's boundaries as well, mm-hmm. that the profession has. And so important, like you said, to be able that we're exercising that muscle frequently to build more fluency, and having that opportunity, again, education and ongoing specific to ethics, not necessarily just from our profession, but other professions as well.
Yes.
Yeah. But then shifting into that supervision piece, like you mentioned, when I was in my master's program for marriage and family therapy, there really wasn't a standard anywhere that any class said the objective of this class is to teach you how to collaborate. I'm very lucky that I had a few professors who were very passionate about client collaboration, and so they gave us assignments, and we did role plays in classes. Mm-hmm. But again, those weren't specific to graduation requirements. Those were just that's something they're interested in. I learned how to write a letter to a psychiatrist to initiate contact and how to collaborate with them. And that experience has been so invaluable for me because mm-hmm. it's given me language. We're not writing letters as much anymore. We're sending emails or we're doing phone calls, but it's still given me language and given me a format of how to best reach out to those professionals, right? Mm-hmm. So we do need that, I think, first, yes, definitely at the university, definitely at the academic level, and then in supervision as well. That was actually a personal goal I had coming into Joyscape, was I want to learn how to collaborate better with OTs and SLPs. I'm very lucky that the agency that I worked at before Joyscape, we actually had in-house SLPs and OTs.
That's a recommendation the article makes.
Yeah, and I feel so lucky that I got to have that experience, because while I collaborated with them, we were friends. We were coworkers, we were colleagues, and so we already knew from the get-go, this is our team, and we had regularly scheduled team meetings. That was just part of the culture there. We're this is just what we do. So I didn't have to go out of my way. We all were on the same page already about we don't need to be in conflict because we all know what the goals are and how to approach it. It was very easy for me. And so coming to Joyscape, I set a personal goal with my mentor at the time, hey, I want to learn how to collaborate with OTs and SLPs that aren't in the same building as me, because that was a skill that I had not yet had.
Mm-hmm, mm-hmm. And wonderful point, because that is something is that they encourage to hire outside of their discipline for the same company, for bigger companies. And I think that is crucial because, like you mentioned, it's a culture. So it's embedded in the DNA
Absolutely.
of that center, that the way of doing things. It's just it comes natural. So when you step out of that, right, and which is more common to not, like right now, we just don't, it's not common.
Right.
There are some companies that do it. It's great. But you get to see that how it benefit you.
Yeah.
But then being able to get those skills later in your profession, it's like, oh, well, if it was, given to me before and, to be able to do things, but practice, nothing can compensate for practice, right? Practice builds not only fluency, but confidence to be able to say, hey, this is something I'm fluid with. This is something I feel comfortable doing. And being able, if you don't feel comfortable, to step out of those comfort zones, which is something the article mentioned as well, is collaboration helps you step out of that. Effective collaboration, right? Awesome points. So just kind of sharing the code of ethics, like you mentioned, they give a self-assessment of like kind of a really cool kind of rubric of, how fluid is your team being ran, right? Or, how is your collaboration? So another great reason to check out this awesome article, because it does have some actual tangible things that you can take into if you're a practicing clinician working and collaborating on a team, something you can definitely take into your practice and use. And at the last kind of note that I had was just like the unity of purpose, and they're committed to the function as a collective unit. And something we've been emphasizing, anytime you're on a team, right? A team approach doesn't always just mean, hey, I showed up for the game, right? You have to perform, but also perform within your scope and work as a team. For one goal, whether that's, from my sports background, like, we want to win, right? And winning in my cases, or my perspective, right, is just seeing the client make progress, seeing the family feel more confident and have the skills and tools they need to feel like they can manage behaviors or teach skills to their child. So yeah, any last awesome thoughts? Code word number 2 is hodgepodge. That's something we didn't mention, but I thought it was really good that the article kind of used that term, because we don't want like this hodgepodge of let's just put it together, right? But it's calculated and it's formulated in a way that is going to create better outcomes. But any last thoughts that you had, Jen, from just the article and in general the topic we've discussed?
Yeah, I think in reading this article, it actually made me super grateful for all of the time, effort, and energy that I've actually spent like pursuing both of these degrees and both of these professional licenses and credentials, because I do feel like a better informed clinician when I show up, and I'm just so grateful that although my path was really funky and I got a lot of pushback in it, in the beginning from a lot of people, they're like, well, why are you doing both? This doesn't seem necessary or appropriate. But I love to see how both specialties help me show up in different scenarios. And I really, value the effort that these other clinicians, in other disciplines, it's like, yeah, I know you got a master's in this. I know you had to put in the field work hours or the training hours. And so having that perspective of like, I know how hard you worked for this and I know you have this expertise. And so like, make me a better clinician, teach me. And so I just really love that we're talking about this, and like, we're both having experiences being able to collaborate with other individuals in their professions and just seeing the awesome benefit that it's having for these clients. And so I just love that we're here really wanting to make ourselves better and be better for our clients and be better for the community as well.
Yes. No, great. Well, it was so nice having you on.
Thank you so much for having me.
And your perspective and all the work you've put in. I mean, it's awesome. And so we're so glad to have you on the other end of, your first couple of months as a BCBA. So I'm sure you're knocking it out of the park. So we loved having you on today. So that wraps up our 6th episode, focused on interprofessional collaboration. Again, please make sure to email podcast@joyscapetherapy.com with both the keywords that were given throughout this episode. And thank you again for tuning in. Have a great day.